Hey, I'm Sierra, and here is my blog post for module number 3. The leadership skills I think are necessary in order to secure staff would be planning. You have to plan for call-outs. You have to plan for surgical patients coming from the OR the next day. You have to plan for cath lab patients. You have to collaborate with the clinical administrator and decide, what your staffing needs are. If you're short a nurse, if you can give away a nurse, you have to really think about who you can use if you are short. If you have on call, you definitely use your on call. As a charge nurse, I never want to call in my red call because you get interrogated and you get asked 50 million questions of why you called that person in, because they get paid a ton of money to come in because they're your red call. You have to be able to problem solve pretty quickly with, like I said, your call outs. If you have to send a nurse home sick, and you have to be able to be flexible and adapt to if we all of a sudden go into surge and we are getting all of these patients in the ED that need to be admitted. You have to kind of hurry up and figure out, who you're going to bring in. And you also, if you are not short staff, but if you have low census, or if, your census drops quickly by a lot of discharges, you have to figure out who is next in line to send home. If they don't want to get sent home, then you have to figure out who's next in line. And it's just really important that you communicate and you talk to the other floors too. If you do have low census, a lot of times the nurses don't want to go home because you have to use your PDOs. So you call around to the other floors and talk to the other charge nurses to see, if they have any staffing needs, if they need someone to come in. So it's really important that you can plan. You can plan ahead. You collaborate with the clinical administrator about your staffing and your needs for the next day so they can call in. Also, float pool, if there is float pool. And if you have sitter cases, you have to be able to determine if you can give up a tech or a nurse to be a sitter if we don't have any sitters in the hospital. The next question was talking about the literature that I found. The literature that I found was on interdisciplinary teams, and I definitely would use this in my practice because not each patient has one problem. When they come into the hospital, they have a million other problems, and having different healthcare professionals working with your patient and their expertise gives them better outcomes. I'm not going to ask a cardiac doctor about my patient that's on dialysis. Just not going to happen, because they're going to tell me, well, you need to figure it out, or consult whoever to take care of that, because I don't know. That's just the reality of it. And it's good to have different resources and have doctors that can take care of different parts of the patient, so you are taking care of the patient as a whole. Even the hospitalist, they can only do so much. They only know so much. When you get more in depth about cardiac and nephrology and neurology, they're automatically going to be like, well, let's consult, Dr. So-and-so or Dr. So-and-so. I feel like the different levels and departments I need to work with in order to be successful would be The different levels would be my director of emergency services, which is Amy Short at Wake Med Cary, and also the director of surgical services, director of cardiovascular services. Because we get all of those patients, and if there's issues, you have to go to those directors with specific issues on their patients that we are getting on our unit. Levels, the different levels, the different departments. Definitely case management, that's going to be your number one department. They're going to take care of all of the physical therapy, occupational therapy, because as a manager, you don't really have a lot of time to do all of that. Also, PT, OT, to get them coordinated, when they are on the unit. Behavioral health, they're going to help you with your IVC placement. The staffing department, because you need float pool staff. Clinical educators, the education department, definitely. Those are all really critical departments to have on your side to be successful as a manager. And I feel like I would prefer, I think, both vertical and horizontal structure, because vertical, if something is not happening at your specific level, then you need someone with more power. I know at Wake Med Cary, or Wake Med in general, we have one, chief director of nursing, and then you have the director of emergency services, of surgical services, of cardiovascular services. I think it's great that you can all go to one person that has a little bit more power than you do with issues and concerns, and just help with, just help with your unit in general. And also, vertical, the people above you have even more power. So if you're not getting help from the person that has just a little bit more power than you do, you can always go above them if you're not getting the response, just like the chain of command in nursing. The model we have at Wake Med Cary, we do patient and family-centered care, and that's our care model. We involve the patient and their family into their care, because a lot of times these patients have to have somebody else to help them. They can't do it alone. And so involving them within the care team, it really, really helps eliminate a lot of confusion, and you get more questions answered, because usually the patients are they're tired and they're ready to go home. Involving the patients, you get, as my own experience, you get greater patient satisfaction, because you have that extra, input. You have that person that is thinking of questions that you may not know to ask. As far as Wake Med, the Wake Med organization, we have, it's both vertical and horizontal. So you have your chief director, and then you have your assistant directors, and then above them, you have your executive directors. And so it's kind of like I was saying earlier, where we have a vertical and horizontal, and it is a matrix, because there is a lot of the responsibilities fall within different departments. So not one person is in charge of every single thing. The responsibilities kind of do overlap. In the model of care at my agency, I am a staff nurse, and the next level of management would be a supervisor. And we have a nighttime and a daytime supervisor, which are also our clinical educators. So I think that pretty much sums it up for my clinical organization and how we do things at Wake May Cary. And I think that's it. So I hope you guys have a great day.